What are things that you would recommend someone who's considering family planning, like what that looks like?
It doesn't mean that, oh, they did this blood test and I'm in the gray zone. That means I can never get pregnant. No. So that just means you may or may not, but it tells the fertility doctors how well your body's going to respond.
This is not anything political, but try to breastfeed if you can. It really delays the estrogen that you're exposed to.
Good evening, everyone. Welcome to YEP's 6th annual Women's Power Hour panel, our first event of 2025. We needed a little bit of a breather after our gala, candidly, but I'll say this is going to be the year that you see more quality from us than quantity. We are not necessarily as focused on hosting as many events as we've typically tried to, but we really try to embed a lot of intentionality into everything that we do. Before we dive in, I just want to gauge the energy. How are people feeling? Woo! Well, I love it. Thank you for that. Thank you for being gracious with your energy. Thank you for being gracious with your time. Thank you for being gracious with your funds. We really do not take any of this for granted, and we are really, really grateful. For those of you that don't know me, my name is Sanafik Birara Gabru. I am YEP's, or Your Ethiopian Professional Executive Director. I've played this role for about 3 years now, but I've been a part of the organization, I think it'll be a decade soon, so it's a really big part of my life. I'm also on the board of directors. I know a lot of times when people come to our events, they don't necessarily know much about our organization, which scares us sometimes because we feel like, are we not doing a good job of telling our story? Because we've been around for 15 years. Our organization is a teenager. It's starting to talk back to us now. But you know what? It's also a great opportunity because we love reintroducing ourselves. So I'll say, just a little bit about YEP, because I don't want to take the full hour because it's 15 years, that's a lot of time. But I'll say, we try to do 4 things. We try to inform, we try to connect, we try to inspire, and we try to elevate. That's really what we embed into every single program that we launch and every single event that we do. And let's get real. Regardless of your political leanings, I think we can all admit that these are some heavy times, right? Things have been tough. It's a tough time for nonprofit organizations, and YEP is no exception. But you know what? We're here. We continue to show up for you, and we appreciate you continuing to show up for us. So today, I just ask that you be present, that you stay connected with us. If you don't follow us on all social media platforms, please do so. I know we have QR codes kind of all over the place. And I will say, Women's Power Hour isn't just a program, it really is a part of our DNA. It is such a sacred space for people to come and recharge, uplift each other, and really remember that we have a lot of power when we show up for each other. So I know I'm such a fangirl of this event, so I can't wait to get off the stage and just absorb. But before I do that, I just want to say thank you again to everybody. I do want to say thank you to our sponsor, Roaming Rooster, very generous. They always show up for us. And then I want to say thank you to HQ. Please, a round of applause for this incredible venue. I don't see Tyrell, but they've been so gracious to us. And Jonathan, the MVP. So we are very, very excited. And last but not least, the heartbeat of our organization is our incredible team that works tirelessly to bring events like this together. I always love doing this. They hate it, but I just want to acknowledge them and call their names. So Beth over there, Kirubel, Beatty, where's Ready? Ready? Am I missing everybody? Okay. I know we have a few people that are not here, but the team is really what fuels everything that we do. And last but not least, I wanted to hand it over to our moderator, our Deputy Executive Director, and the brain and heart behind Women's Power Hour. This is her baby, Asti Mengashagobe.
Thank you. Thank you, Sanafik. I appreciate you. Welcome, everyone. This is going to be a real intimate event, and I'm so glad that you all are here. I echo all of the things that she said. For those who are not familiar with Women's Power Hour, this is our 6th year putting this program on. The whole intent behind it is to focus on topics that are part of our journey in womanhood. We highlight incredible experts and subject matter experts, people who are in their fields and dedicated to their craft, and we bring them here to, one, highlight their journey and their careers, and also look at critical insights that they may have to share with you all that we all could benefit from. So this year, we're doing women's health. If you all were here last year, we did women's health as well, but it was a fitness focus. This year, we're looking specifically at preventative measures to care with a specific kind of approach to reproductive health. I was talking to these two ladies, and we could go thousands of directions with the topic tonight, but we only have an hour, and I want you all to definitely think through some questions you all may have to fill in the gaps of what I may not catch or things that they may not share. This is also an opportunity for questions at the end, so we look forward to hearing from everyone. Engagement at all times. So, without further ado, I want to go ahead and introduce our two speakers. Okay, so I told them I was going to condense the bios so that we can have more time for them, hearing from them, so you're not hearing from me the whole time. Okay, so our first speaker is Dr. Samrawit Barhanu. She is an OBGYN physician in Northern Virginia, originally from Ethiopia. She moved to Texas for high school, studied at Purdue University, earned her medical degree from Penn State, and completed her residency at the University of Maryland. Passionate about serving underserved communities, she practices obstetrics and gynecology and community health and serves as the medical director of her hospital's obstetric unit. She also mentors students and teaches future healthcare professionals. She lives in Virginia with her husband and 2 daughters. Welcome, Dr. Barhanu. And then our second speaker is Dr. Bethel Samson Bayu. She is a medical director, health tech entrepreneur, and public health advocate with expertise in global and digital health. She founded Atege Health, Ethiopia's first femtech startup, and co-founded MedAfri in Rwanda to support cardiometabolic health. Currently an MPH and an MBA candidate at Johns Hopkins and a global health strategy intern at PATH. She focuses on digital health, financing, and innovation. Passionate about health equity, she is shaping the future of digital health in Africa and beyond. So welcome, Dr. Bayu. So it's so funny, when I was reading through the bios, I was like, ooh, there's some big words in here. Hopefully I don't stumble over, and I stumbled over every single one. But that's why they're here. So welcome, you two. I'm so excited to jump into this. What I usually like to do is start out with a little background, understanding your journey into medicine. So let's start with, why medicine? Like, what made you pick that area? I know a lot of us in here always hear the usual things from our parents. Go this way, go that way. But what's the authentic reason for you? Exactly. Ooh, okay, yes.
Exactly how I started. I thought I was going to be a civil engineer. Oh, this is not working. Oh. I thought I was going to be a civil engineer, just like my family. And then I started to develop this passion for women's health. And so I decided to maybe consider medical school. At that time, it was a pain applying for medical school. And I took a year off because I couldn't do applications and undergrad at the same time. So I was boarding in my sister's basement for a year trying to figure out all 50 applications, and I got lucky, got in. And then once I was in medical school, then I said, you know what, it would be cool to do radiation oncology, and it sounded so cool. So I decided to study health physics, and then, you know, like everybody else, I didn't know what I was doing. And
That's real.
But then I actually spent a month in Ethiopia at the Gorambasa and Yakatit in their OB ward, and that was just an eye-opener for me. And I said, this is my passion, this is what I want to do. So I got into OBGYN residency, and then started off in private practice. Loved it, but there was just something missing for me. And so my passion towards underserved medicine continued, and then I joined community health, and that's going to be my home.
So let's back up a little bit. So you were born back home?
Yeah.
And then you came here?
Yeah. So I
Talk a little bit about that as well.
Yeah, so I'm the youngest of 4, and my siblings were all here, and I was lonely back home, and my parents were happy to ship me off under the care of my sister. So she was like my guardian. So I came here 16, started high school. And so, I mean, it was quite a transition. I don't know. I guess back home, you go to school with the same kids from kindergarten all the way through. You know everybody. And then here I am. They thought I was they used to call me a princess from Africa, right? Because I'm in Texas in this tiny school. But I mean, I got through that 2 years. It wasn't fun. I didn't enjoy it. I missed home. But I think it helped me be able to accomplish what I wanted to do, figure out the whole college application system.
And then for you, Dr. Bayu, you recently arrived, and you've been, let's walk through your journey, because it's a little different from Dr. Brahanu.
Yeah, not as impressive, I have to warn you. But yeah, so I went to medical school. So I went to kind of give you background. I was born and raised in Ethiopia. I grew up in Arat Kilo. I don't know if you guys know it, but
Crazy neighborhoods. Shout out.
Shout out to Arat Kilo. And yeah, so my dad was a doctor, and my brother also went into medicine. And then I was always a lot like my dad, so everyone was kind of cheering me on to go to medical school. And I think, and right on the first semester, I hated it. But I went to the same school as my dad and my brother, so I was a legacy child, and like everything was. And then I remember stepping in, and I basically hated it, and I realized, okay, what can I gain from this, and what did I really not like about medical school? And for me, was that it was just so much into the disease and the cells and the tissues as it is about a whole human being, and there are a lot of doctors, such as Dr. Sam, who can see the human beyond like all of the disease and all of the issues. And for me, that's what I wanted to work on. So a lot of the times where, when we're learning in class, they would say like, oh, patients just don't adhere to medication, and they would move on. And for me, it was like, why not? Why don't they adhere to medication? Why don't they get screened? Why don't they do that? So I've always, and every time, even when I became an intern, they used to just talk to me about their lives. And I'm just that person, like when you meet me, you can just, I think it's because I'm also open. People just tell me a lot about their lives, and I just learned that I want to do more. So starting from second year of medical school, I started working in these programs in women's healthcare. So I started doing this project called Double Impact. We used to go to private offices and then teach about breast cancer and cervical cancer. And I didn't have a lot of medical knowledge, but I used to get a lot of my friends that were in like the 3rd or the 4th year to go and to like do this breakdown analysis of like why you need to get screened. And I think like all you needed to know was that like there's a disease called breast cancer. If you get screened earlier, you'll catch it earlier and you'll be fine. And that knowledge is so important. And also cervical cancer. So there are a lot of things that we're going to get into, but me knowing that is also power. It's like telling my friends, telling my mom, telling my aunts. It's enough. So, and also one thing is that I had aunts who died of breast cancer. So I had an aunt that like basically raised me, and I saw her from going this like beautiful fancy aunt, like rich auntie, like beautiful fancy auntie, and she had cancer. I kind of watched her go through like those moments. And like I learned that a lot of like my aunts had passed away of that, and I kind of, ever since I was a kid, it's been ingrained in me that my mom's had a lot of sisters, and they were really around her through all that. And I think about, okay, there are a lot of women that don't have that. So when I went into medical school and I joined this, I really wanted to work in breast cancer and all the things that are in women's healthcare. So yeah, that's my villain origin story.
No, that's really powerful. I think one of the things when I talk to people who were in the medical field, a lot of the times I think for people on the outside, it looks like the prestige of having doctor in front of your name, but it really is that the core is like that passion of connecting with people and wanting to give back that keeps you going. So I want to touch on the pivot that you figured out that you wanted to work with underserved. Like what clicked for you? Because you could have just kept doing private. You could have kept just, doing your thing. But was there someone, was it a mentor? Was it another person? Or was it just something that you realized that I need to have that connection?
I think it was just personal satisfaction. In private practice, I would find myself getting home and finishing off charting and explaining why this patient didn't trust what was offered to her, and she's getting like the high-end medications that, you have to go through so much approval just to have insurance covered, and she has the best private insurance, and yet she's, still arguing as to why that's not enough. And my mind is always thinking, there are so many who don't even have insurance or the basic. So there was just that void that I just couldn't find from private practice.
Yeah, no, that I could see how that is.
Yeah.
Like, it takes a toll.
And then the other big thing is, obviously, I speak Amariña, I'm in the DMV area. There's so much of us, so many of us, and such a need to be available for basically our own people to be able to explain how they feel in their own language. And I'm right here, so why not create that access? So that was my other big driving force.
No, that makes sense, having that personal connection, and language always is a way to break down barriers and get people the access they need. So it makes a lot of sense. I know I promised them I wasn't going to focus too much on the career aspect, but I do have one more question before we transition into more of the insights that you all may be interested in as well. I'm curious about, one of the things that's really important for Women's Power Hour is looking at mentorship. And I know that you mentor, and then I'm curious if you're experiencing mentorship. What does that look like in your spaces? It doesn't necessarily have to be someone who looks like you, sounds like you, but is there someone you can think of that was really critical to your experience? I know I didn't provide this question in advance, but if anyone comes to mind, I see you shaking your head. Maybe you know off the top, if you want to go first.
Yeah. So for me, I didn't really mention this, but when I moved here around 8 months ago to do an MPH MBA at Hopkins, and there are 15 of us who's doing an MPH program, and around 6 of us are from the same school. That's from Nazareth, and I think there's a lot of Nazareth students here. But 6 of us are from Nazareth school, and I think for me, a lot of my mentors were my teachers. But then I would say I had this teacher. She was a surgeon. She's a surgeon at Black Lion. And when I had a really hard time in medical school, hating it and going every day was a pain. And she taught about breast cancer, and I remember she was she saw me struggling, and she never gave up on me. And that was the one teacher, I always mention her whenever I go. Her name is Dr. Tetanna. She was not only a general surgeon, but she then specialized to be a pediatric surgeon. And she cares so much about her patients. She cares a lot. And it was she basically took the time to make sure. She used to teach the rest of the class, and she used to say, "Beti, are you how are you?" And at first I used to get offended by it, but she really made sure that I understood. And it's those classes that I actually ended up taking into making my first app, and to breaking it down and making sure that women felt comfortable. So she really taught me a lot of things about how to approach students in a very toxic environment in medical school. She still had the time to mentor me and to move forward. So for me, she's the one person I would actually mention.
I mean, just one comment about mentorship. I think there's just different levels and type of mentorship. There is career mentorship, someone who tells you this is how you apply, this is what you do, edit your essays. There is someone that you look up to who gets you through like the hard moments of being beaten down, you just want to quit. And then there's also emotional mentorship, someone that you lean on where you show your weakness, that you're not afraid to show how you feel. So I think it's so important to have those 3 levels of mentorship in whatever field.
Yeah, no, I agree. I think sometimes we think about it from a career lens of like, okay, this is what you need to do, this is how you get to the next step. But it's the people that check in on you mentally, the people who check in on you to make sure you're good, so you can continue, that are critical. And sometimes those are just folks that aren't in your spaces. Sometimes they're not people that are in your career field. But mentorship at the end of the day is just meant to like give you that oomph to keep going. So that's really good to hear.
Yeah, I mean, I will say the person who helped edit my medical school essay was a lawyer.
There we go.
And
shout out to our attorneys.
I still give him big shout out. If it wasn't for him, I don't think I would stand out. So there's different level of mentorship.
Oh, okay. So one thing I do want to say is that here you go. One thing I do want to say is that more than like, I have a lot of mentors and they're not all in the health field. There's like, especially when I got into tech, I spoke to people that were in ed tech. I spoke to people that were in media. I spoke to people that were in advertising, and they all helped me. But what's really important is that you have your mentors, your mates, and your mentees. Like, the whole idea is that if knowledge does not flow through you to the other side, then that's like a Dead Sea moment. And I think what really matters more is that even now, when there are like students that are trying to apply for schools or are trying to get into entrepreneurship programs or they're trying to get into health tech, I think those are more motivators for me to work harder, because they ask you questions and they say, oh, didn't you have this? What happened? And I hate having to answer things that I haven't done, even though that I know I could have. And then how are you going to mentor others to come? So they actually really motivate me to keep going. And yeah, like, I can't wait to welcome them next year when they come to Hopkins or when they are in these events as well.
I love that. Lift as you climb. You reach back and you support those. That's major. So I'm glad to hear that. So I'm going to leave them alone. I'm not going to ask any more about career, because I know they were like, let's get to the next part. So we're going to pivot now to focusing on more of the, I think, like the insights that are relevant to our health. So I provided them some questions. Some, as I mentioned earlier, there's just so many different directions we can go in, but we've narrowed it down to a couple themes. And so we're going to run through that. And so I guess my first question, and I want to ask both of you ladies, is how can we increase access to reproductive health screenings and preventative services for all women, regardless of insurance and income? And I'm going to repeat that question, but before we get into it, one of the things when I was trying to prepare for this panel, looking at stats, so I wouldn't know what I'm talking about when I'm up here, it was kind of jarring to see how much Black women are, the stats around it are just kind of grim. It's in terms of health equity, in terms of things that are preventable, things that are just in terms of like service provided. So I really want us to be open to hearing some of the things that they have to say. So a lot of it is going to be talking around like access and equity as well. But it was just really kind of tough, the stats that I saw. And I know that we've talked about it on our prep. But going back to my question, what does increasing access to reproductive health look like for you, Dr. Brahanu?
I guess it depends on where we are politically, right? Mm-hmm. I think it depends on where you are. Mm-hmm. I think we are lucky here in the DMV area. There's different levels of access, but it's a matter of knowing what resources are out there. Mm-hmm. I will tell you, for example, where I work, there is for women who don't have insurance, who don't qualify for Medicaid, or they don't have the income for private, there's a charity program. So I think the first and most important thing is knowing what resources are out there, because there are a lot of resources. And again, it's making sure that the people who who need it know where to get those resources. And then I think it's also knowledge, knowing that you do need to have breast cancer screening, that you do need your pap smear, this every so many years, and being willing to say, okay, let me make my, health a priority. Where can I get this health care? Yeah. And I think from that, even if you go to any of the big hospital sites, you can see what different levels of programs that they have. So it's actually looking for that information.
Is there like a consolidated, one of the things I want to make sure people walk away today is like tactical strategies or resources. Is there a website or somewhere that you would recommend for finding those resources? Try and think through.
So I think when it comes to, for example, Medicaid, you can go to the government websites and it's very clear as to what the requirements are, who can meet those resources and who can't. But then for the other more charity-based programs, looking at the specific hospital sites, and every hospital has a finance department, and it's picking up the phone call or walking into the hospital to say, okay, what resources do you have, and getting that information. I mean, for the hospital that I work for, there's a patient advocacy department, there is a patient relations department that it's a phone call to say, I need help, where can I get, or how can I get care? So I think it's a little bit of advocating for ourselves. There's no one consolidated page, unfortunately, because obviously the hospitals don't want to advertise this because it costs money. But being our own advocate, self-advocate, and getting those resources from so the big ones here are GW, Georgetown, in Virginia, Inova is the biggest one, and they all have some kind of program.
Okay, so that is helpful to know about how to navigate. I think another way, just in discussion with both of you, is like looking at how we can empower ourselves and get the knowledge. And I think if you could talk a little bit, Dr. Bayou, about Itege, your app, understanding what it is, what it's for, and is it something that people here can use? So talk through that a little bit more.
Attendees was launched in 2019 in November, so we turned 5 pretty recently.
Congrats.
So we're walking and we're almost in kindergarten. And so for us, like when we first built the prototype of Attendees, it was really not supposed to go as big as it did. But I was part of a program called the Ethiopian Medical Students Association, and it was just one of those group projects that no one wanted to be as involved in because it was very time consuming. But then it was about breast cancer, how to do a self-breast examination at home. So I was working on it with software developers and with a graphic designer to kind of show women the basic mistakes that a lot of women make in doing a self-breast examination. So it's mainly about starting at home, doing it yourself, and then knowing that it's you and you can start those things at home. So yes, especially the settings are different from here. And in Ethiopia, here you can get an ultrasound, you can get a mammogram. Those things are available here. Doesn't mean they're accessible? No. But they're available. In Ethiopia, we do not have that many mammograms. We do not have ultrasounds that are very available and affordable to a lot of people. So we were still in the progress of showing women they can do this at home. And so that was what the app was about. Going forward to that, we realized that, it was a very small prototype that was launched. So we wanted to do something bigger. And we had another app called Sawa. We did a peer tracking, and then it also did, but in an Ethiopian calendar. And then we had an anonymous Telegram bot that we launched in towards the beginning of 2023. And we realized that we had a lot of products that we were trying to launch, but the Telegram bot that took 2 weeks to make made the most impact because it was anonymous and people could ask anything they wanted. So it was going to a point where our server was crashing, the amount of people that were asking us questions. And they would ask us about breast cancer, they would ask us about cervical cancer, they would ask us about pregnancy, family planning, and all of those things. So it led us to we collected the questions and we realized that there's a lot we don't know as doctors. So the things that we learn from school, as opposed to going out and actually listening to patients, those are completely different things. So we did capacity training for healthcare professionals afterwards, and then we also are relaunching our Telegram bot. That's coming out soon, but it's a Telegram bot. And we launched a social media called Tege, still with the same name. And we've within the first few weeks of launching it, we were able to have I think around 12,000 followers on TikTok. And it was because we were asking and answering the right questions. So I know you asked me a very simple question. So you can get us, you can reach us on TikTok. That's where we are the most active right now. Mm-hmm. And we're launching the Attendees Telegram bot in a few weeks.
Yeah, I think what I'm starting to learn as I get older is it's a combination of using apps and using different things to kind of get smart, but then also going to my medical providers to make sure that I'm getting the actual knowledge from them and not just spiraling on WebMD. So it's you try to find that balance of taking, I guess, control of your health, mm-hmm. so that you can be in more preventative mode than having to deal on the care side. So thank you for sharing that. Dr. Prahanu, something I saw online, it said that a lot of the times OBGYNs are the first doctor that women see, and a lot of women will see in their journey in their healthcare, and it may be the first. If they don't go to a primary care, maybe you may be the first person. I'm really curious to hear from you. What are 2 to 3 things you think women in this room should just be doing to take ownership of their health? Is it specific vaccinations? Are there a lifestyle? What are things that you would come to mind for you that people in here could walk away with?
Oh, my favorite question. You're right. Most women of reproductive age, so looking at, I guess now it's getting younger and younger, right? But let's say 18 to mid-40s, you don't really need a primary care physician, right? You feel great. If you have a cold, there's urgent cares everywhere. Even CVS has one. So you don't really need to establish care with a primary care physician when you're busy or going to school or you don't have the best insurance or your deductible is crazy. But an OBGYN, you don't want to get pregnant, your periods are heavy. So you're right. You're more likely to establish care with an OBGYN than any other specialty. So I think as OBGYNs, it's our opportunity to grasp our patients and guide them in the right direction, focusing on preventative health care before the problems of diabetes and hypertension and menopause and all of those symptoms come. So I think the biggest thing from a preventative standpoint is cervical cancer screening. I'm a strong believer that cervical cancer should be eradicated because it's one of those cancers where it is so slowly growing and it shows us so many signs before it turns into cancer. So that's what a pap smear is. A pap smear is basically screening to see if there's any signs of abnormal cells forming that can lead into cervical cancer. And it never goes normal to cervical cancer, right? The disease progression is it takes 7 to 8 years on the average person if you have a normal immune system. So if you have an abnormal pap smear and you do just the basic follow-up of just getting that biopsy or just getting that layer of treatment, you're preventing yourself from getting cervical cancer. So I'm begging everyone to stay on top of your pap smears. Yes, the speculum hurts, it sucks, and it hasn't changed. It's been the same, it goes from metal to plastic, but it still hurts. But cancer hurts more, so it's worth taking that time. And we've spaced it out. Before we used to say every year. Now it's, if you're younger than 30 and it's normal, it's every 3 years. If you're over 30, you graduate and you go to every 5 years. So it's not asking for a lot, but it can prevent going through unnecessary treatment. The other big thing is breast cancer screening. We don't start that till age 40 unless you have a family history or any risk factors.
We hear a lot about people saying, well, radiation, I don't want to expose myself to radiation from mammogram. The radiation from a mammogram is extremely small. It's like if you stood outside for 6 weeks, you get the same amount of radiation. So getting that one imaging is worth it again. And we are seeing a growing number of breast cancer in our Ethiopian patient population, especially actually in the DMV area. And they're doing a lot of genomic studies to figure out why. So we don't have answers. We don't know why, but the only thing we have is screening. So that's a big thing. And can I keep going? Okay.
Of course, please do, please.
The other thing is Gardasil or HPV vaccination. Unless you're born here in the United States, you probably have never been offered Gardasil as an option because it's fairly new. And it's recommended starting like age 11 before you're sexually active. And what it does is it protects you from getting HPV virus or the high strand, the high-risk ones, because we know that HPV is the virus that can make your pap smears abnormal, which can then lead to cervical cancer. So if you get vaccinated, you're protecting yourself from HPV and, again, preventing cervical cancer. And the HPV comes from being sexually active, but men have no symptoms. They're not bothered by it. It doesn't affect them, and therefore they're not screened from them. So we can only protect ourselves, and HPV vaccine is the way to go. And actually, they are offering it to boys now in efforts to protect the girls. So if you have young kids, they can get it as early as age 11.
Let me ask you this, since it's top of mind right now, and we've talked about this. I think, what's the stigma around the vaccine for Gardasil, and I think what's the benefit of this event? You have the cultural nuance, like what, if you could speak that to maybe you've encountered or those conversations, what does that look like in working with someone?
Yeah, so the HPV vaccine right now is optional. And the goal is to get the vaccine before girls and boys are sexually active, before they're exposed. So there is this stigma of, well, if I give my 12-year-old this vaccine, which I know is technically an STD, am I saying go ahead and have sex, right? So am I giving the green light for my kids to head in the wrong direction? But obviously that is a misnomer. It's actually protecting your kids. And it's, you only get 2 shots if you're young, but if you're older, it's 3 shots. And initially was only approved till age 26. Now they've expanded it to age 45. So it's not too late for everybody to get the Gardasil vaccine. There was also some misnomer that it could cause infertility, but there's no data to support that.
Do you have another tip? Because I know we can keep going.
Yeah, and my other big thing is coming back to, when you're young and healthy, you don't have a primary care. So again, focusing on prevention. One is, I'm sure you guys talked about it last year, about fitness and preventing obesity. I mean, obesity is the leading medical condition in women of reproductive age. So when you're young, that's the right time to get your fitness right, to exercise, to eat healthy. Because if you wait till when you're ready to have a baby or when you are starting to get blood work for your cholesterol and diabetes screening, it's too late. So I think healthy lifestyle while you're young.
Dr. Bayu, do you have any other things that you, like, from your experience, even now with you pursuing your MPH, like, what are things that you may recommend or can share with the group?
I was literally listening.
I know.
So for me, I think that one thing I would say is that the cultural influence doesn't really leave us, even though we've left Ethiopia. It's like the typical, you can take the person out of Ethiopia, but you can't take the Ethiopia out of the person. It's like, it's very typical because it's the fear that we have of vaccination, the fear of knowing that really keeps us from really preventing these illnesses. And even though like we grew up with Ethiopian moms, maybe if your mom's not Ethiopian, maybe this may not apply to you, but if you really grew up in an Ethiopian setting, that we still have those behaviors of not really wanting to know like wanting to know, because that's the scary part.
Chugurfalaga.
Chugurfalaga, yeah. A lot of our patients, I think that, so I did last year, yeah, I think actually the year before. So in October 2023, we did a screening with the Ministry of Health, and we screened around like 300 women for breast cancer. And I think something I learned was that a lot of women were first really scared to enter the door of like screening. When they realized it was free, a lot of them came, but they were still afraid. There was this girl who was crying when we were like doing a manual, like she was crying. And I remember just like listening to their stories about like how their parents died of breast cancer, how like there are so many things that came. And one thing I would like to say is that knowing will help you prevent it, and then believing that prevention is the key. Like at the end of the day, it's not gonna hurt you. And also something that I've learned is like the food here is definitely different from Ethiopia, and which means you really need to work. Like, you really need to be mindful of what you're consuming. And this is like really increasing the risk of breast cancer. Not just even here, but in Ethiopia, we have a lot more young women developing breast cancer. And it's hormonal things as well. And I think that I don't have any proof to say there's a lot of hormones in the food. Like, it's not something I'm going to say. But there are a lot of things that we are putting ourselves at risk for. Like, for example, having oral contraceptive pills for longer than 3 to 5 years. It's not something we should be having. If you're taking any contraceptives, or if you don't want to have kids, if you're trying to use a family planning, try to use implanol, like something that is like inside, that gets inserted inside, I don't know the...
Nexplanon.
Nexplanon, like in Ethiopia we call it implanol. Or get an IUD that doesn't have estrogen. And then make sure that, this is not anything political, but try to breastfeed if you can. It really delays the estrogen that you're exposed to. And then the other thing is that if you are, like in this economy, you cannot tell people to have kids before they're 30, but the longer you're postponing it, it's like, the whole idea is that, especially if you, one of the reasons I think that we're getting a lot more cases of breast cancer is because we're having our periods earlier. So to give you kind of a brief understanding, it's that the longer that we are exposed to estrogen is the more that the body our body gets exposed to breast cancer. So having our period earlier, which is like now I think 10, 9, there are a lot of girls that are getting their periods around that time. That means if your kid, if your sister, if your cousins, they're getting their periods at that time, make sure that you let them know about breast cancer. And then, like making sure that like the more a woman breastfeeds, she's suppressing the estrogen factor. So like the more it's delayed. And especially like when menopause is also set in later, or if you have to take estrogen replacement therapy, that also prolongs the time. So just being very mindful of that. And it's because that obesity, it's because it has fats, and like the more fat you have, the more hormones are produced from your own fat cells. So just making sure that you are maintaining a healthy weight. And just because a person looks skinny does not mean they have a good fat content. Like making sure that you are eating healthy also matters. And take advantage of the fast periods that we have. So that's what I would say. And then the other thing that I would want to share about is also making sure, if once you hit 25, you're not above, even before then, you're not really above getting screened like for cervical cancer. Even in Ethiopia, we have these tools. So make sure that you're taking like as much as you can to get screened for cervical cancer. And also from your blood sugar, like every time you go to the hospital, try to take advances of like, how's your blood sugar? Because a lot of the times we see that young people are presenting with symptoms of diabetes like much earlier. And all of those things, like if it's caught early, even hypertension, diabetes, if you're pre-diabetic, if you're pre-hypertensive, there are life modifications that you can take that you don't even need to go through, diabetic medication. You don't need to go through hypertensive medication. It's all about like taking advantage of the little checkups that you have. in the hospital and making sure that you're advocating for yourself to get the right screening things done. So yeah.
No, thank you for that. I think you're right. It's just the more you know, the more that you can actually make a more informed decision on your health.
Sorry, one more thing to
course.
add is family history. There's so many times I would ask my own family member and be like, anything in my family history? No, nothing. What happened to so-and-so? So it's very typical. And then, all of a sudden you have a cousin who has breast cancer and they'll be like, oh yeah, did you know in Tanamako that's what happened to her? You're like, were you gonna tell me? So I think taking as much time as possible to know family history, because there is genetic factors to the cancers out there. We don't think about it, but there's relationships between breast, ovarian, colon, uterine cancer. So gathering as much history as we can. And now we're really advancing on doing genetic testing. So if there is an immediate family member who got diagnosed with breast cancer before age 50, there's concerns for a genetic component. And now it's even through just saliva. So technology has really advanced, and you can identify to say, okay, am I at a higher risk, and therefore do I start my screening earlier than what's recommended, which is 40. So take advantage and always update your family history as much as you can. Because you may not make the relation, but your doctor can be like, oh wait, I saw, last year you said that your cousin had this, now you're adding your sister, okay, there might be something there. So keep track of the family history.
Yeah, I just want to add, like I see a few men in the room, even though it's not a lot of you, but it's still enough. Yeah, it's still enough. So for me, one thing I want to tell you is that my dad actually tells my mom to get screened every year or every 2 years. So whenever she wants to go to a monastery, she wants to stay for a while, I have old school, modern parents, and whenever she wants to go somewhere, he says, I need to see your mammogram results. I need to see that you've gotten screened for these things. And I think that's such, I don't know what to call it, but it's such a caring thing. And I think, and a lot of men actually, when we launched our Telegram bot, when we launched our period tracking app, all of those things, there were a lot of men who were downloading it. And actually, one of my first assignments after I launched Sabo, that period tracking app, was to call every customer, every person that has registered, and say why did you download it? Was it helpful? And I kept encountering a lot of men on the call, and I'm like, did you download this? And they would say, yes, it was for my sister, it was for my wife. And there are a lot of people that ask us questions, and I think they're the real heroes, being able to kind of step out and think for your partner, for your mom, for your sister, those things really matter. So just make sure that you are reminding, even if you as a woman, are you reminding your mom to get a pap screening, especially if she's in Ethiopia, by the way, because no one's gonna tell them if you don't. So make sure that you are looking out for each other and you're looking out for your family, and be a good partner, be a good friend.
That's the exact word. What your dad does for your mom, that's partnership.
Yeah,
that's really looking out for, if she's healthy, he's healthy. It's a cyclical relationship. So that's really beautiful to hear. I'm glad to hear that. It's perfect what both of you talked about, because it kind of transitions nicely into family planning and fertility discussion. I'm curious to hear, we see it, people are waiting later and later to have kids, whether it's career or if it's just personal decisions or whatever the reasons are, you're starting to see a change. Or I'm assuming medical practitioners are probably seeing that change over time. What's advice that you could give to women, and to honestly also to men, because I think sometimes we're too hyper-focused on the women making the decisions about children, but men also need to be prepared for getting themselves in order. What are things that you would recommend someone who's considering family planning, what that looks like in terms of resources or things to keep in mind?
I guess the first thing is there's never a perfect time to have a child. I think we all feel, okay, let me do this, and then let me do this, and then I'll have my baby, and then, you're chasing so many things
and then that perfect moment is never there, or when you're ready, then the clock has ticked. And unfortunately, as women, we're born with a finite number of eggs, and the quality of the eggs and the number of the eggs just naturally decline with age. For some, it declines faster than others, especially when you're trying to have your first baby. It gets harder and harder as we get older. So by definition, if you're over age 35, you get labeled as advanced maternal age. They used to call it geriatric, right? But that was just wrong.
Wild.
That was wrong, right? So wild. Yeah, so now it's advanced maternal age, and that's when they see the change in the slope of fertility getting difficult, and then that slope kind of gets more steep after 40. For those who are capable and planners, there's always the option of egg freezing. I mean, that comes with its own territory and cost and ethical beliefs. But I always say, have your information. If you're someone who thinks you're going to delay childbearing, get your information. There are a lot of free seminars. The huge infertility clinics like Shady Grove and Dominion in the area, they have a lot of just like online free seminars to say, this is the process, this is what it looks like, this is what it costs, this is what it would take for you to use your eggs to have a baby. So I always say educate yourself, because what's right for Bethel may not be right for me, and what's best for your cousin may not be right for you, right? So educate yourself so you can make the right decisions. The misnomer that using contraception, oh my gosh, I started birth control pills when I was 18, and now I'm 32 and I'm having a hard time getting pregnant. That's a myth. There is no correlation between using contraception and fertility. So if you're at a point where you don't want to get pregnant, use your contraception, right? It's not going to affect your future fertility. And then again, it's prevention and healthy lifestyle. We know obesity is one of those things that can disrupt your menstrual cycles with like things like PCOS, if you guys have heard about it. It makes it difficult for you to ovulate, and then it makes it very difficult to get pregnant. And then if you get pregnant, it increases your risk of miscarriage. So again, try to maintain a healthy lifestyle as much as possible. One thing I always get asked in the clinic is, can you do a test to make sure everything is fine? I wish there was a magical test that we can either ultrasound or just be able to count your eggs. There's no golden test to check how things are. I mean, if you pursue infertility treatment, there are things that they can do to like count your like follicles, which are the little eggs that come, or there's a blood test that they do. But again, that's to see how well you're going to respond to treatment. It doesn't mean that, oh, they did this blood test and I'm in the gray zone. That means I could never get pregnant. No. So that just means you may or may not, but it tells the fertility doctors how well your body's going to respond. So in summary, there's no golden test. You know the timing for yourself. Be as healthy as you can, and never wait for that perfect moment to have a child, because you know, my girls are 8 and 6, and I still don't feel like I'm ready to have a child. So,
it's funny. I hear you on the it's never a perfect time. I see like with a lot of my friends who are going into motherhood, and just their experiences. And the reason why I'm asking about family planning, I'm thinking also, or fertility, I'm thinking also about the stories of women who get pregnant and they find out they have fibroids. And like it's the you're finding out in those moments. Could you speak to any type of, I don't know if it's preventative, is that something that's taken care of during the pap smear? Is that like something you ask for a separate sonogram? Like how do you find out that before it's too late or when you're in your pregnancy?
yeah. So I mean, specific to fibroids, if I brought my ultrasound machine and I sonoed everybody in here except the men, majority of the women will have some kind of fibroid, whether it's a tiny one or maybe a big one, and you're like, I just thought I was fat. I couldn't exercise, and I keep exercising, and it never goes down. So fibroids is one of those tricky things where it could be big and not give any symptoms to people, or it can cause heavy menses or a lot of pelvic pain, pain with intercourse. So it does typically give symptoms. And if it doesn't give symptoms, even though you find out about it during pregnancy, you're not going to do anything about it, right? Unless it's in the way of the pregnancy. And that would be something, obviously, that would be discussed with the doctor.
Thank you for, I guess, normalizing it or just dispelling my worries, because like the way that everyone was saying that, I was like, whoa, like what do I got to do to make sure? But thank you for sharing that. Or did you have anything?
Yeah, so I was just going to say that as well. I think that there are fibers that you would have that you like. My mom, or like a lot of my aunts actually, they would like tell us about how they would be pregnant. They went to the bathroom one time and then they felt something like drop, and then all of a sudden, like, turns out they thought they would just say, oh, like this thing happened, and when they went to the hospital, apparently they had like fibroids, like that.
And it just passed.
It just passed, yeah.
Oh.
There are a lot of things.
New fear.
Women's bodies are just like magical. Women have I think also something is like some women might have like very small fibers and they might hurt. Some women may have some of the symptoms would be that you would have heavier periods, and then you would have that's like sometimes you may have, but a lot of women don't actually have symptoms, especially earlier on, and there's not much that they do. One thing I do want to say about family planning and fertility is that we're also seeing this in Ethiopia, like where there are a lot of women that are delaying that, and as working women, as professionals here, like that's something that we all see, and it's of course like your experience in fertility is definitely not going to be the same as your mom's, or like it's not going to be the same as your cousin who decided that she was prioritizing like family life. It's not. But the more you do delay it, the harder it becomes. And I think as a person who just got engaged, like these are like moments that I think about, and I'm like, okay, like even as a doctor, I think about, okay, should I delay it? Like, is it the right time for me to do it now? Like even knowing the risks and knowing like how much that would affect like my fertility, I'm still like on that debate thing. And I think it happens to a lot of women. But instead of like pressuring women to kind of to say, okay, you don't have so much time to do that, just making sure that you have a good partner that will like actually help you through your fertility journey, and that is gonna be there to stand by you in these moments, and just kind of making sure that you have a support system for infertility or for children. There are a lot of times. From one thing I learned about working and in obstetrics and OBGYN, like as an intern, is to have a good partner or not have one at all. Like they're so useless. A lot of them, you can have partners that are like, there are different types of partners, but the really good ones, they will help you throughout the journey of child care as well. So just making sure that we're not when you're telling somebody, okay, I think it's good to have kids earlier, also make sure that partner should also look at how it would be for your fertility journey, because it's not going to be easy a lot of the times. I've seen like a lot of women in Ethiopia as well going through the whole journey of that, and then you're all of a sudden called geriatric. Like you're minding your own business and someone's calling you geriatric pregnancy. But at the same time, like I think that we should just really prioritize making sure that going through a lot of the fertility medications, going through a lot of your journey in being pregnant. Pregnancy also has a lot of complications. I don't know if we're going to get into that, but pregnancy also has a lot of complications that we should all know about. I think like I really want to hear more about that from you as well. But I think in terms of pregnancies and in terms of family planning and how that's related, a lot of women actually, a lot of the questions that we get asked is that if I take if I take Plan B more than like 2 times or 3 times a year, would I still be able to get pregnant? The answer is yes. Like it's just gonna the more you take Plan B, the lower the lower the effectiveness is going to be. So that's why it's not recommended to keep taking it a lot of the times within that year. And that's but there is no correlation to fertility or long-term fertility. So that's a lot of the questions that we get is during that. So it's not really, there are no studies that shows that it has long-term effects in a person's fertility. So that's one thing I wanted to point out.
I wanted to add a little twist to what you said. I'm actually a strong believer in that, the fertility journey is a very personalized journey, and everyone has to find what's best for them. And sometimes that could be a journey that you don't want to share with a partner. And there are a lot of resources out there for women who opt to use, whether it's donor egg or conceive from a partner that they're not committed to, whether it's through the pregnancy. There is, family naturally, with Navasha, we have a lot of family support, but there's also doula services that insurance companies are now paying for. So don't be afraid to go through the pregnancy journey if that's what you want, and be limited by the presence or absence of a partner.
Okay.
This is also a great segue into looking at the pregnancy and then post-care. I think I don't know if everyone, but take for granted how much, how lucky people are at the end of those 9 months to be able to have had a birth, and then also just whatever the process looked like, if it was safe and it worked out. I'm curious to hear what are things that you could say to that in terms of the mental toll it takes on folks during those months, and then also postpartum. I know there's so many different ways we can go, y'all, so I'm trying my best to capture everything, but I'm really curious to hear what your thoughts are on what that journey looks like. And you did say it was personal, or personalized for folks, but just any tidbits you've seen for making it through, and then also the post. It's an odd question, but I'm just curious to see.
I think early care is key. And again, it all comes with prevention. I think one of the struggles that affects someone's experience in pregnancy and postpartum is when there's this expectation and the outcome or how the pregnancy goes is very different than what the patient expected. And then that can actually lead to postpartum depression. So it could be, I want to have a natural delivery, unmedicated. I don't want a C-section at any cost. And then, life or the pregnancy takes a different toll and different direction. And then say she ends up with a C-section, then it leads to, I can't believe this happens, and it can lead to postpartum depression. So I think one of the key things is having a baby is a natural process, right? I think that's how we've all been here, especially, those of us born in Ethiopia with very little intervention. So having a baby is a natural process, but you also have to be very, give your body a chance to guide you instead of trying to write the narrative, because you can't control it, right? You can only focus on the things that you can control, right? Being fit, eating healthy, going to your appointments, taking your vitamins. But if things take a different direction, don't use it as a failure. Don't use it as things are not right. Oh, the doctor did this to me. It could be a lot of things, but just trust your body and follow the guidance of your pregnancy. And then postpartum, I think support is key. We are seeing a big increase in the rate of postpartum depression, and that goes with just increasing mental disorder in the country. And it's unfortunately, mental health is not very much discussed in our community. It's seen as a weakness. It's seen as being kabat anandi, right? So don't be afraid to listen to your body, to listen to yourself. If something doesn't feel right, it's probably not right. And make sure you know where to get help.
I think for my Well Women's, the annual that we do, I think nurse practitioners or providers now are asking about your mental health state. In the beginning, they'll do a questionnaire. Have any of you all had that experience? Yeah, it'll be like a questionnaire, 1 through 10 or whatever scale they have, just to kind of get an idea of where you're at. And then sometimes it feels like a trick. You're trying to answer questions, and I'm just like, what is happening right now? But I really I value that, because I think earlier on when I would do my yearly, no one was asking that. It wasn't something that was a part of it. So I think there's been a change for sure.
I have a funny story about that. So I had a older Abasha patient, and my staff tried to give her the survey question in English. It wasn't going well. So I interpreted it in Amariña, and I was going through the questions, and it gets to the one point where, any thoughts of hurting yourself or anybody else, and it was like, basma. So, that just shows you it's something that we don't discuss openly, let alone screen for. So we have to change that, and I want everyone to feel that they're supported and there's resources out there.
Yeah, I just want to ask the question. So you've mentioned something about doulas, and then there's a time. So as a medical professional from Ethiopia, I don't really know much about doulas. And how do you work together with them? I know you're the interviewer, but I'm just stepping in. But when is the right time to use a doula, and then when is the right time to kind of ask for an OBGYN?
So the doula is not a healthcare provider; they're a healthcare support, and that's someone that you get on your own to be there as maybe someone to guide you through prenatal care, to give you advice, to say, hey, my doctor's trying to start me on this. This is how it's making me feel. So someone to bounce ideas off of. It's not a medical degree. It's just a certification that people of interest go through. During labor, they help with labor support. And then postpartum, they help with the baby care, concerns with the baby. They come to your house. So it's basically a labor support person.
And also, perfect segue, one of the questions or discussion we talked about was understanding empowerment and self-advocacy. How can we better equip women, especially women in the room, to advocate for themselves within this healthcare system? What does that look like? And what are those interactions with you? And do you take offense? What does that look like for you in your interactions? And then also from your perspective for being here.
Yeah, that's a tough one because I see it from both sides. I see it as a healthcare provider, and which can sometimes be perceived as someone being difficult and being non-compliant. And, these are the words that is thrown out from the healthcare professionals. But then from a patient standpoint this is who I am, this is what's important to me, and empowering and making sure you're advocating for yourself. So those two can clash significantly most of the time. And that comes from, patients are not like that out of nowhere, right? It's because of all the structural racism that's going on, the bias in healthcare system, and we're actually doing a lot to bring change. And especially for Black women, when you raise your voice, you're the angry Black woman when you're just advocating for yourself. So the way I see it, I think it's very important to establish care with a provider that you can trust. If you don't have trust in that provider, then I don't think the pregnancy care is going to be really, really long. Sometimes patients have a certain thing in mind, and they go doctor shopping till they find somebody who agrees with them. And I also don't think that's the best way to go about it. So I think it's key to find a provider that you can trust, who can understand your values, to say what's important to you, what matters to you most, and then you have that shared decision making where you're looking at the pros and cons and coming up with the best care. And you can also respect the advice that's been given by the provider. So I think it's important to find someone that you trust. And you don't have to be your own doctor, but you have to be able to feel listened to and to trust what the doctor is recommending.
Before I go to you, in an instance where someone is I know my body, like I know what's going on with it. What does that look like in being in a room? Because I think about, the first person that comes to mind is my dad. He does not go to a doctor until it's the very last, resort, right? Like, he knows himself. And I think about people who are stubborn, lovingly so, but I wonder what those interactions with, and luckily, like for you understand the culture, you also have there's no language barrier, but I think when they interact with folks who may not look or sound or have the patience, I wonder what are their options? Is it they find someone else? Is it you move on? Like, what does that really look like?
So I think it depends on how acute the situation is, right? So if you're in the outpatient setting, you go, you find out you're pregnant, your pregnancy is positive, you're excited, you go see the doctor, and you're just not vibing with that doctor, then don't push it, right? You have plenty of time to say, let me find someone that I feel that they're listening to me. And there's a lot of data coming out about concordant care, that there is better care provided by someone that looks like you. Because there's that level of understanding. I mean, I'll give you an example. When I have a diabetic mom, when I send her for nutrition counseling, she goes, but the stuff on that list does not apply to her. But when I sit down, I'd be like, okay, how many times a day do you eat injera? Like, okay,
Okay.
So
Yeah.
I think that's where concordant care makes a difference, because you kind of speak the same language.
Yep.
And we're not just talking about race, but it's language, it's military, it can be anything, but someone that shares the same values so that they can provide kind of personalized care for you.
Yeah.
So I think finding that is very important. And then in terms, if it was a more acute situation where you're in the hospital and someone's refusing and being stubborn, one is there are situations where you can ask for a different provider and say, I just do not want to be cared by that doctor. Okay. I always say, in terms of advocating for yourself, there's always a patient relations department at every hospital, where if you feel like your primary care team is not listening to you, you don't know who to go to, you're frustrated, and you should never feel retaliation, right?
Yeah.
Every healthcare provider takes an oath. But if you feel like you're not cared for, there is someone who can speak on behalf of yourself.
Yeah. Well, I think that's exactly what I was looking for, so thank you for that. Dr. Bayou, do you have anything that you would like to add from your experiences thus far?
Well,
Or in the past or current?
I would say that you would have more power here than you would in Ethiopia. Like, as I think that just the difference of the bedside manners here as opposed to the ones in Ethiopia, we've really made it. Like, once you're in a hospital here, that's what I really believe. Because it doesn't matter really where you are. If you really want to advocate for yourself, it kind of comes from knowing what to advocate for. And that's education. Like, I think that as educated women, we're not really educated unless... Oh, can you hear me now? Okay. So I was really dropping some gems here. But one thing I would say is that you really need to know what you're advocating for. There are a lot of patients that would come and ask, it's not unrealistic to them, or it's not out of scope for them. But for that doctor, I think that as much as that doctor wants to help you, there's also things that they cannot do for you. And there are a lot of things that you need to do a lot of the research for yourself. What I don't recommend is when you're going saying that I have proof that you've been doing this wrong. So it's all about how you speak to your doctor. Yeah, a lot of the times that I've seen, it's like, oh, I know the doctors are poisoning me. They're even in America, which I was really surprised of, but there are a lot of times where you have to kind of knowing that as long as you're speaking in a very respectful tone and you're understanding. From that, I think even if you speak to any doctor, I don't think it's just doctors like Dr. Sam. I think any doctor, it's like as long as you're coming in and you knowing what you're advocating for, you're saying, okay, this is how I feel. This is the reasons why I feel this way. And if you're not really looking eye to eye, you have the power to change you have the power to change your doctor. Then they have the power to change you as a patient. And this is something I've learned from health law, so you can apply it anytime and you won't get in trouble. But like just making sure that as patients have a lot of power in terms of like rights here, and you should definitely make use of that. And yeah, just making sure that I know that it's gonna be very hard, because I think we have the opposite problem here as we do in Ethiopia. In Ethiopia, is like a lot of the things that they would come up to ask you is just mainly like cultural. But here it's like, it's from the internet or it's from Google. And there are so many different research that are being done that are like opposing to each other. So you kind of have to then go back like as a doctor and do your own reading. So just know that your doctor also has to go their own reading when you're presenting these cases and these researches to them. So just making sure that you're advocating for yourself, but just know what matters, and prioritizing that it's your health. As long as you are saying it in a respectful tone, that doctor has the absolute obligation to answer you.
I think one thing I was going to add is, one thing I would discourage is sometimes we have, I've had 3 C-sections. I want a normal delivery. Mm-hmm. And I'm going to go door to door to door till I find a doctor who's going to give me that. That's in a way advocating for yourself, but it's against standard of care and medical advice. So I will say, when you're advocating for yourself, do your research from standardized and medically proven sites, and be careful what you read out there, and stop doctor shopping once you feel that you found a doctor that you can have a relationship with and trust, so that you can have the best outcome for yourself.
Thank you both. That actually wraps it up pretty good for me, because I was going to ask, how does a patient balance, especially with our cultural background, like medical advice when it doesn't align with their values or their experiences? And I think you all both touched on it, being a little bit more informed in how you approach the situation, and also just thinking through what is actually available, readily available, and who you're working with. And I love the idea of not shopping around until it's like you're looking for someone to tell you what you already have decided for yourself, and you only know what you know. So I appreciate that. So I'm gonna stop talking, and this is an opportunity for you all to ask questions. An hour is only but so much, so I'm hoping that there may be some questions that you all are interested in. So feel free. I think Kirobal, he has our guy in the room. I think he's going to pass out the mic, but feel free. You have 2 medical practitioners who can literally answer any question. You don't need WebMD. Okay, maybe not all questions, but within their purview. So there you go. Okay, yeah, perfect.
So when you guys speak, I just ask that you all stand up. Just so
Yes, perfect.
Okay. Hi, my name is Baliu. Thank you both so much for your insights. I was going to ask a question around, I guess, one of the stereotypes within our community around basically one of the fears of preventative care, or like going to the doctors in general, is that your insurance is going to automatically go up and they're just going to like find something to diagnose you with. So you were speaking to the benefits of like basically being diagnosed with like pre-diabetic or pre-hypertension. And an example in my life is I was about to be diagnosed with like some sort of pre-asthma. And I remember my mom making like a huge fit and like switching doctors. So I'm just wondering, like, do you guys have any advice for something like that, and like how to, get that preventative care, but also sort of avoid some of those insurance pitfalls? This may be too specific, but I'm just curious.
Yeah, currently with commercial insurance, pre-existing conditions shouldn't affect your premium. I can't speak for the future and what direction our country is going into, but currently, whether it's commercial insurance or Medicaid, pre-existing conditions shouldn't affect your premiums. Now, as we go into Medicare, I don't know if that looks a little different, but for current insurance, it shouldn't affect it.
Okay, that's great. Thank you.
And when you think about it, for the insurance companies, it's cheaper for them to treat pre-asthma than it is like a full asthma exacerbation and 2 weeks in the hospital. So they do preventative care is actually free and doesn't really require a copay. So that's one of the reasons why when you go in for just your well woman exam, it's considered preventative.
Did you have your hand raised? Right here? Okay, so you and then.
Thank you so much for all that insightful information. Learned a lot. I'm kind of curious as to why nutrition is not covered extensively. And I know some doctors even agree the fact that they get very little training. And I think that's kind of wreaking havoc because there's limited coaching from the providers. And then, to be honest with you, even the public, right? We're inundated with unhealthy food. We're always on the run. Just kind of curious as to why that's not a priority. And then ultimately, going back to that, us empowering ourselves, what's the best way that we could be informed and making sure that even with our culturally appropriate eating, that we're, really doing the right thing and doing what's going to be beneficial to our health?
I mean, I think that's an excellent question. And I will be the first to admit that I have received very, very little education on nutrition going through medical school and being in practice for the last, over 10 years. And any education that I've received is one that I have done on my own. So that just shows you that our system is broken when it comes to more of that holistic touch. And I think it comes with just the history of nutrition and diet was not under the kind of care of the provider and the physician, and it fell through to the dietitian and kind of been kept separate. But now we're realizing that if you don't fix that, no medication is going to fix the problem. So it's a broken system, and I think we are late to recognize that. But I think they are making a difference in medical schools, and I think for our kids, we will see a difference. But I think, unfortunately, for us now, we are seeing more insurance coverage for nutrition and dietitian consultations. So that's something you could definitely look into if you have insurance. And that's being covered some more.
Yeah. So one thing I would also add is like I said, my father is a doctor, and when he got diabetes, that we didn't even know where to go, and it's like a house of 3 out of 4 people are doctors, and it was very surprising to me when I came to the U.S. and I'm realizing, okay, this is also a problem here. But the rule of thumb is that if you're having a plate, make sure that 2/3 of that plate is vegetables and like green things, and you have your protein. That protein can be different things. I'm not gonna say like you should buy organic, use this smoothie, and all of that. But making sure that you're eating enough fibers. Like fibers means green vegetables. It means injera, like teif injera. And teif injera might also be like something that is not like that available to you. Just making sure that you're eating a lot more fiber in your diet, and you are having balanced meals. So it's not about cutting off carbs or cutting off sugar, just making sure that you're having a balanced diet. And then like taking a walk, like a 30-minute walk every 2 or 3 days, that makes like a significant difference in your day-to-day life. So like especially for even the people that have diabetes, what is recommended is that they just take a 30-minute walk. It doesn't even need to be a high-intensity walk. Just take a 30-minute walk every 2 or 3 days, and don't let it be more than 3 days. Just making sure that if you're going a certain distance, walk. If you have access to the gym, that would be great for you to get regular exercise. But it's not about you taking a magical pill that will prevent you from being pre-diabetic. There are like little things that you can do in your diet as well that shows actual improvement just improvement in your life.
And if you don't mind me asking a follow-up question, I feel like I'm pretty capable and knowledgeable. I did sell diabetes medication, but I was quite surprised when I recently saw my doctor and she told me, especially around nuts, right? Portion control is important. I didn't know 1/4 of a cup was the recommended serving for your entire day. So you're not to eat that, 3 times a day. So I think that's also an important component of that teaching about portion control. Even things that are good for us, if we're not watching how much, could actually be working against us. So I think there's a long way to go around nutrition. So thank you so much.
Yeah, just one thing I wanted to add is that, so when we started my second venture in Rwanda, that I should have mentioned by now, but this is exactly what we focus on, is mainly on diet, exercise, and mental health support. What we've realized is that we gathered a mental health and a mental health specialist, a psychologist. We had a life coach and a nutritionist, and we had an internist, and we came up with this guideline that would help patients with 3 months, and then we were trying to kind of get as many patients to be involved. But what we realized was that it has to be a holistic view. So it's just there's a reason why patients fall off. We call them clients now. We don't use the word patients anymore, but there's a reason why our clients fall off, and it's because of the motivation. And there's a reason, are you sleeping well? Are you getting enough sleep? How well rested do you feel after sleeping? It doesn't matter if how much alcohol do you consume. And a lot of the times, it's not just about reducing grease in your food. It's about looking at yourself as a holistic human being. How are you feeling? How are you mentally? There's a lot of reasons why you don't adhere to a certain diet. It's not about having that one, Ozempic thing that cures you of those things. It's about looking at yourself as a whole human, giving yourself some time and some grace, but also allowing yourself to move forward. So just how are you every day? Just making sure that you're tracking how you're feeling. And then if you have on a couple of days where you haven't felt your best, what did you eat? And on the days you felt like you were healthy, what did you eat? What did you see yourself having the most change in? So these are some of the things that we had in our guideline as well that that really helped me personally. And then some of the we're gonna launch it soon, and we're gonna see how it's gonna affect other people as well. But just making sure that you have also a doctor that responds to when you're having a nutritionist or a dietitian that asks you these questions, and that doesn't go what did you eat today, or what have you exercised today. There's a reason why you don't follow up on what was said, So just making sure that you're tracking that as well makes a huge difference.
The majority of my friends we're in our 30s, and we're considering, the more we're planning about families, delaying having children. And so do you recommend freezing your eggs prior to 35, or do you feel like we should wait?
Yeah, again, I think that's a very personalized journey. Your peak reproductive age, somehow they've come up with 28.
Oh.
Right?
Gone. That's long gone. Thank God.
But no one is thinking about egg freezing at 28. So I will recommend that if you are considering egg freezing and that journey, the earlier you do it, the more eggs that you would have, and the easier the treatment would be. Or because you have to pre-medicate and take certain medications to optimize the number of eggs that they can retrieve. So the younger you are, there's more of those eggs. So if you're going to do it and you can and you're thinking about it, the earlier the better.
Okay. I do have a secondary
But 30s
question.
is not too late.
Okay, perfect. Second question. You guys indicated that you are seeing more postpartum in our community. Do you have any indication of research that's been done and why the cause is? Because growing up in Ethiopia, it's not really something that you hear about. And my feeling towards that is because the amount of support that you get as a new mother, you have so much community, and here, more oftentimes, we don't. And do you think there is a correlation with that? Or do you think there is sometimes too much support and not enough boundaries, so you don't feel like that child is your child and it's the community's child?
Good luck. You know,
There's a lot to unpack.
I can relate to what you said. I mean, I think after I had my first daughter, I was ready to go back to work because it was the first one. There was a million people. Someone's telling you, hold your breast this way. The other one's telling you this, don't turn the lights on, don't do this. And then you get overwhelmed, especially if you're not used to having that many people in your house. So it could be a clash between, our Ethiopian side and our American side. That could have a factor. But I think it's just the growing amount of stress and just, there's just a lot of more pressure in everyone's life, and postpartum just tips you over. And it's not just for the Ethiopian community, but it's being seen kind of across the nation, and it's actually starting to be seen as one of the highest reasons for maternal mortality is mental disorder. It's getting up there along with cardiac disease and people passing away from heavy bleeding. Mental disorder is becoming one of those leading causes. It's in the top 4. So it's just a national trend.
Okay.
Yeah.
I do have one last one, and this has to do with vaccines. I think we're growing in an era where the conspiracy theories is not just for white people, right? A huge part of our community does not believe in vaccines, and we've seen that a lot with COVID, whether it be cultural or religious preferences. Have you found successful ways to convince our people to get vaccinated for these things, especially when it comes to their kids? We're seeing a big case of measles, rising, and especially in the DMV is happening. So any successful tricks or tips that you have to convince people that this is imperative for them and for their children?
Yeah. So my personal technique is always to start with the patient and understand where they're coming from. So before I put my recommendations as to why and start, sounding like a textbook, I always say, what are your thoughts? Do you have any hesitation? Why are you hesitant? What do you know about it? Tell me, let me start off with what your understanding is, and then I take off from there. And I find that very helpful, so it's not just regurgitating what I know, but meeting the patient where she is to say, let me know, and then filling in that knowledge gap as best as I can.
Yeah. Just like a couple things that I want to add. On the postpartum, it's not just depression, there's also postpartum psychosis. Like, there are a lot of things that are postpartum that we don't talk about. And a lot of the things that I've realized is that just like cancer's been there forever. People just don't know what it is, so they just don't talk about it that way. And I think that our generation is just more bold in not masking it. I think for generation, it's like, I see a lot of patients as well that kind of show symptoms. I'm not going to boldly say, like, yeah, you have postpartum depression, but there are a lot of patients that I see, like, even in, like, my 3 months of practicing, like, that in that internship ward, I've also seen a lot of those things. Postpartum depression has different causes. It's not just something that has happened and you might have it at the time of your postpartum. It might be some of the stressors may have happened all your life. There are also things that pregnancy and birth brings up. Like, let's say you've had different types of traumas in your life. When you see that kid, there's definitely things that it brings up. I think for our generation, we're just stopping the masking and making sure that everyone smiling for everybody. I think that's kind of what's being known now. There are a lot of people that have committed suicides that we hear a lot of stories about women that have committed suicides. I think for us, it's just we've stopped masking it for our generation. And I think that's really good. But at the end of the day, we still have a lot of stigma on, labeling them as bad moms, as instead of getting women that help. So we see those things in Ethiopia a lot. It's just society doesn't let you feel depressed. They just don't let you feel any of your emotions. You don't have space. So at the end of the day, you don't really get to channel that in at that. The second thing about vaccines is that in a lot of the research that we're seeing, even at public health and in Bloomberg, is that there are a lot more children that have measles now. There are more the vaccines have now are suffering from their own success in a way that like all of like the disease that were eradicated are now coming up and they're like happening in the US. So all the kids in Africa, you know, when people used to say, you know, there are kids suffering in Africa, there are kids suffering in the US now because vaccines are like available. And I think one of the things I felt insulted when I was in that class was there are vaccines, but they expect everybody to be vaccinated, so they don't want to like explode, like, you know, I don't want my kid to be exposed to vaccinations. But make sure that you are taking that step to protect your child is like something we really need to drill into. Even at home, I think this was like one of the things we were talking about in terms of Gardasil. In Ethiopia, people don't want to vaccinate their kids because they're thinking this is going to cause infertility. So no one is doing that. So it's something that you have to advocate. And I'm tying it back to like what can we do today is like for you to advocate that like this is important. So yeah, that's one of the things I want to add.
I think we have time for like one more question. Okay, so two, but they gotta be real concise, real concise.
Thank you again, everyone. My question is actually about the postpartum. We know now that a lot of people are having kids late, after 35, 40, and we know also something what we don't talk in our communities, perimenopause, menopause, postmenopause. All those hormonal imbalance and change has impacted, and most women actually after 40 has been diagnosed with depression when it's not depression, when it's actually the causes, postmenopause or perimenopause or this menopause hormone change. So do you think the increase in what we see in postpartum depression is playing with this hormonal change? Should we educate women, especially when they are pregnant at that time? The hormonal change will be one of the impact. Is that something that is included in the postpartum care or maternity care? Is something like that?
Yeah, I mean, that's an interesting look on it. I think it's very difficult to go from pregnancy to menopause. You're right that if you had children late in your 40s, the transition into perimenopause may come sooner, but it wouldn't explain the postpartum depression in the first 6 weeks. I think if it was related to hormones, it would be just low estrogen levels in your body just from being postpartum and breastfeeding. But I think the biggest risk factors for postpartum depression is, like you were saying, undiagnosed mental health issues, that fatigue, not sleeping, worrying. Naturally we're balancing a lot more now, right? A lot of women are career oriented. They tell you you're disabled just to get paid, right? So there's a lot that we're balancing in that postpartum period that just takes a toll. And we're doing a better job of screening too. I think that's one thing that we need to make a note of, that we weren't screening to this degree before, so we're catching more women with postpartum depression who wouldn't naturally come out and talk about it. But you're right. I think what we're doing now is after you have a baby, you should go for your Well Women exam 6 months later, then to see how you're adjusting. And then if there's concerns of perimenopause or anything of that sort, it would be addressed at that point.
Yeah. Thank you. I just want to add one more thing, is that a lot of the times, the studies that were done and the base of Western medicine was really based on men. And a lot of the symptoms relate to men and not women. Even the signs of heart attack does not apply to women. Like the typical signs of heart attack in women go unnoticed. The typical signs of stroke in women are not known. There's a lot of research when it comes, there's a lot of gap. Even when I was in Ethiopia, and this might be an Ethiopia thing, but I'm sure that happens in the US by the looks of things. But one thing I've noticed is that anything that can be related, so women get misdiagnosed a lot, just like what she's mentioned in terms of depression and anything that has to do with our hormones not being diagnosed. Another thing I've seen is that women just being referred to gynecology for very medical reasons that people don't understand. So at that point, you really need to do your research. Those are the times where you need to say, okay, how does this apply to women? It's not just about what is it. Like, and most of the time, you are not going to find it in medical books. You're not going to find it in those things. More research generally needs to be done, but you also need to know, what does this symptom look like for women? And those are some of the things that you really have to read into. Yeah.
Our last question.
This is changing gears a little bit, so I don't know if the answer can be concise. But understanding that intimate partner violence and gender or violence against girls and women is going to be a significant concern, whether in Ethiopia, the US, or just globally, and how it has adverse outcomes on people's health and so on. Are you able to kind of integrate and address that into the care that you provide and the communications with like community engagement and things like that?
Yeah, I think one of the big goals nationally is to put more focus on what we call social determinants of health. And one of the components of social determinants is how safe do you feel, whether it's domestic, at work, going to work. It also addresses things like depression screening. It addresses housing stability. It addresses having enough to eat. So these are all factors, nutrition, that we know it's not only about the diagnosis, but everything else that affects how we're going to care for the patient. But that is more prevalent than we're thinking. I will tell you, like, for example, in the state of Virginia, all medical providers are now required to do training on human trafficking and how to recognize that to renew their medical license. So that just shows you that the prevalence of these issues are starting to go up in our country.
I want to speak from the Ethiopian point of view. One of the reasons why I stopped practicing was because when I was in the emergency room, I saw a lot of women that came with that were abused. And there are some things that are obvious signs of abuse, and there are things that are not obvious signs of abuse. And you see them in hospitals, you see them every day. But then, there were just moments where women don't just only show up to OBGYNs, but they show up to typical emergency rooms and general OPDs with signs of domestic violence. I don't know how it is like here, which I'm guessing would be similar, but that's really part of that. Also, while working on our Telegram bot, because it was anonymous, there were a lot of these alerts that we kept seeing. So there were a lot of women that were really scared to access care in the first place because they were not safe at that point. So a lot of the times that you're speaking to somebody, you have to first assume that there's a lot they don't tell you about, but then they're also not in the position to seek help where they are. So just making sure that you are opening the space for your friends. It could be your friends, by the way. It doesn't necessarily have to be somebody that doesn't have power, it might be somebody that is your status or even higher. So just making sure that you are kind of sensitive to your friends in those moments. And if you have any healthcare professional friends also, I know that they've went through a lot of those moments, just kind of being kinder to that situation. So whenever you see women that are not seeking that help, even though you know they want to, you know that there are women that have ideas of where they want things to go, but they haven't made that point already. And just making sure that there are times where you cannot intervene, but you can be kinder in that situation. So just making sure that you're putting those things in your mind.
Thank you so much for those questions. They were so thoughtful, and I'm so happy to know that there were things that were not touched on in the discussion. So thank you all for being attentive and then also having such great questions. I'm going to do a quick wrap up, and then after that we'll have a little bit of time to network real quick, and then it'll be the end of the night. So thank you both ladies. I just want to do a quick wrap up. So you can be born in Ethiopia, you can go to school here in the US, you could have came here 7 months ago. You could have pivoted from engineering, you could have launched an app, you can get your MBA or your MPH, you could be a mom, you could be a daughter, you could be engaged, you can be in a leadership position, you can be a mentor, you can be a mentee, you can focus on nutrition, you can be passionate about health access, you can be passionate about breast cancer awareness. At the end of the day, much like their careers, your health is a personal journey. So I'm hoping that you all enjoyed today's conversation and looking forward to next year's conversation. But thank you both ladies. I learned a lot. I was scribbling notes down really quickly, furiously, but thank you both for your time and your commitment to the community.
Thank you so much for having us, and thank you for making this a priority. So appreciate you guys.
And real quick before we go, I know that you had mentioned in a conversation you and I had about resources in the community about screening, and I know you had mentioned that your employer, you do different things in outreach. Is there anything that's coming up soon for either of you that may be beneficial for the ladies in the room, or something that they could consider and share with other people?
We can share through your website. Yeah.
Awesome. Okay, so that'll come up. Anything from you on your end for
I
the
just wanted to
upcoming
say
app?
thank you.
Okay.
Oh yeah, yeah. There is. We have products launching, and then we'll definitely share through you. And I just want to say thank you for inviting me. I know I'm new here, but I'm meeting a lot more people, and thank you so much for just like being invited. It's such a huge honor.
Thank you. Okay, thank you everyone.